A kidney stone is to be specific, is a calculus or stone that forms in your kidney. It's usually made out of calcium, or they can also be made out of uric acid, are the two most common kinds. And they can either stay in your kidney or they can move. And when they move is when they start to cause people problems. They move into the tube that connects the kidney to the bladder. It's called a ureter. And that's when people start to have pain associated with kidney stones. The most important thing I tell patients is 96 ounces of liquid a day keeps the urologist away, okay? Because drinking fluid, dilution is the solution to the problem. The more liquids you have going through your body, it prevents those stones from forming. Other than that though, usually what we do, especially if you've made more than one stone, is we'll have you do some metabolic testing to figure out why you specifically are making stones. That involves urinating into a jug for 24 hours and sending it away to have it analyzed, and then doing some blood tests to see what's predisposing you to making stones. There can be a multitude of issues that are going on. One of the most common things I see, besides people not drinking enough liquid, is they eat too much salt. Your body wants to maintain a level of sodium in your blood. So to get rid of that excess sodium, it gets rid of it through your kidneys. When that happens, your kidneys don't reabsorb the calcium that it's put into your urine, and then you make more calcium-based kidney stones. So that's one big thing. That's the second biggest problem, besides not drinking enough. After that, there can be certain dietary things going on. Either one type of stone, a calcium oxalate stone, can form when people have too much oxalates in their diet. Oxalates are in so many good things that we like to eat. But in certain people, for whatever reason, they tend to absorb them more than other people. When it comes to uric acid stones, those typically tend to happen when people eat too much animal protein. You kind of have to make yourself drink. Luckily, in this day and age, most people have smartphones. So I always tell people, hold up their phone and say, hey, whoever, please remind me to drink liquids every 2 hours from 8 a.m. to 6 p.m. so you get it in. And I always advise them to try to have a bottle that holds a liter. And then if you just finish that 3 times in a day, you're good.